Test 1, 2, 3. Yeah.
I call to order the meeting of the Insurance Benefits and Ledge Committee for the 10th of July.
Recording in progress.
Okay,
Sure.
thank you, Chair Robbins. This meeting is being conducted virtually and in person, so I will do a roll call of the trustees to confirm attendance. Ms. Ginsburg. Here. Mr. Razzo. Ms. Langton. Here. Mr. Rue. Ms. Fessler. Mr. Oakham. Here. Mr. Green. Mr. Moore. Here. Mr. Kehoe, he is here. Mr. Harris. Chair Robbins.
Present.
Staff participating in the meeting include Deputy CEO Louis Lugo, AEOs JJ Popowich and Laura Guglielmo, Chief Counsel Stephen Rice, Legislative Affairs Officer Barry Liu, Director of Retiree Healthcare Cassandra Smith, Consultants Stephen Murphy and Michael Zito from Siegel. Trustees, please use the raise your hand Zoom option to be placed in queue. At this time, we ask all meeting participants to mute themselves until you are ready to speak, and we may now proceed with the agenda. And there were no requests received for attendance under AB 2449.
Thank you very much. Item 3A, approval of the minutes of the meeting of June 4th. I need a motion. Are there any corrections? Seeing none.
Mr. Oakham.
Aye.
Ms. Langton. Aye. Mr. Moore. Abstain. Okay. Chair Robbins.
Present. I'm approval, yes.
The motion passed with one abstention.
Thank you very much. Item 4 is public comment. We do not have any requests from the public to address the committee today. We're on item 5, reports. A semi-annual report on approved engagements. Mr. Liu.
Thank you, Chair Robbins. Good morning, Chair and trustees. Just a quick report, semi-annual engagements. Earlier this year, at the beginning of the year, we did our annual NCPERS conference and again, did our visits with members of the LA County delegation. This was soon after the repeal of the windfall elimination provision and government pension offset. So there was quite a bit of discussion about implementation and challenges. As we can see, some people still haven't received their adjustments yet. So that's kind of slowly rolling along. We also visited with the California State Legislature, lots of new members. So our ledge advocate is able to, make introductions. One helpful introduction was actually with the lobbyists for the California professional firefighters, who kind of gave us a preview of AB 1383. That was certainly helpful. I think going forward, seeing some of these proposals beforehand before they're introducing a bill is certainly helpful. And so we have some technical discussions about that. And then other than that, positions we've taken, apologies of typo on AB 1383. It says support, but actually the board still has a watch position on that. And so, and as a reminder, that bill has stalled in the Appropriations Committee, so it won't be considered again until the beginning of next year in 2026. And then other than that, happy to take any questions on the report.
Anyone have any questions? How about item B?
Yeah, so the engagement report, some items of interest this month, again, regarding Social Security. So we're looking at the depletion date where only about 80% of benefits will be paid. So that's coming up in 2034, which is a year earlier than previously estimated 2035. So yeah, essentially, if Congress doesn't do anything about the shortfall, people's benefits will be reduced down to about 80%. One analysis saw that it could either be 81 or 77%. But if you look at that and say a 19% cut means that you would need to save an extra $114,000 for yourself, whereas a 23% cut would require an extra $138,000. So, if you're only getting Social Security, that's a pretty significant cut for you. The report also notes that the repeal of the weapon GPO actually accelerated this timeline. But again, as we get closer to that date, I think Congress certainly will need to figure out what to do on this. The next item was about also Social Security, and that this year there's been an unexpected surge in people claiming Social Security compared to the same period last year. And some of this can be attributed to more baby boomer retirements. Also, the repeal of the WEP GPO. People are looking at bigger benefits, so maybe more government workers are applying. And then also a lot more people switching from spousal to their personal benefits. So if you're married and you can get spousal benefits, but you also qualify yourself for Social Security, you can't get both. But if you're qualified to the point where you can get a higher benefit, you can make a claim for that. But also, I think there's been some alarmism as well due to changes in the federal level that there might be policy changes to reduce benefits or cut benefits. Also, job security and health considerations are kind of driving more people to apply for Social Security. But again, at the same time, if you apply for Social Security earlier, that can affect your benefits, because the longer you wait, the more the benefit can go up. So there's some concern about that. The next item is about expectations on saving for retirement. So a lot of pessimism from generations from the baby boomers to Gen Z about the financial challenges they'll face in saving for retirement. And so about 6-8% across generations feel that they may never be able to save enough for retirement. And then Gen Z seems to be especially pessimistic, since they're working multiple jobs to deal with a job insecurity. Millennials are caught between the sandwich years and caring for parents and then also raising children. Gen X, again, that stereotype of being the most pessimistic generation. They're going to be turning 60 this year, but they really lag in retirement savings. And then baby boomers some of them are delaying retirement to continue to work because of not being able to have enough money in retirement. And then the last item is, well, there's a magic number apparently for retirement, which is this year, Americans expect that they need to have $1.26 million to retire comfortably. That's down from 1.46 from last year, and that may be due to the fall in inflation. But yeah, the magic number here is about 1.2 million. But if you look at that and the reality of how much people actually have in terms of average or median savings, it's a pretty big gap. And then again, part of it is just not having the confidence to save for retirement. And for example, Gen X, they're also going to be, going to delay claiming Social Security, not so much because they may have a choice, but again, to work longer because they may not be able to have enough at retirement. So, and Gen X and millennials are the ones that are most likely to expect to continue working during their retirement years. So it's, definitely some pessimism there, but it's, apparently the 1.2 million is a number that we're going to be seeing a lot in terms of what it means to have a comfortable retirement. So that concludes my report, and happy to take any questions.
Thank you very much. Item C, staff activities report.
Good morning, Mr. Chair, members of the committee. Just one quick report. You may recall the board approved the 25-26 healthcare premium rates back in March. We were able to get the updated table in our system updated so that the correct deductions would come out beginning the members' June 30th retirement check for the month of July. That's it.
Anybody have any questions of Cassandra? Item D, LACERA claims experience. Michael.
Good morning, trustees. Let me share my screen.
You got to get closer to that mic because I can't hear
Yes.
you.
Good morning, trustees. Okay, my screen is shared. Okay, so this first slide contains the distribution of premium and enrollment as of May of 2025. Medical premiums consist of approximately 93% of total monthly premium. Dental and vision plans consist of approximately 7% of total monthly premium. For this next slide, this next slide contains the non-Medicare claims experience by carrier as of May of 25. For Anthem, which includes the plans 1, 2, and prudent buyer, the year-over-year increase is 9.3%. For Cigna, the year-over-year increase is 2.1%. And for Kaiser, the figures remain unchanged and will be updated in a future report. For this slide, this contains the Anthem claims experience on an aggregate basis and by plan. So for all plans, as of May of 2025, the year-over-year increase is 9.3%, and this is attributable to plans 1 and 2 with a year-over-year increase of 9.8%, and plan 3 with a year-over-year increase of 10.3%. For this slide contains the Kaiser utilization report and will be updated in a future report. And this slide includes the high cost claimant experience for Anthem, Cigna, and Kaiser as of May of 2025. For Anthem, the year-over-year change is 87% due to increased claims and increased claimants, people reaching the pooling point of $400,000. And for Cigna, the year-over-year increase is 4.6%. Kaiser, that figure will be updated in a future report. This slide tracks the members at risk of reaching the Anthem lifetime maximum benefit of $1 million. As of March of 2025, there were 193 individuals, and then it increased to 195 individuals as of April of 2025, with the majority of membership at risk residing within plans 1 and 2. And this slide contains the pharmacy rebates for Anthem, which includes plans 1, 2, and 3, and has been updated through March of 2025. So for the most recent period, there was a 9.1% increase from $197 per retiree per month to $215 per retiree per month. And at the bottom chart, rebates are on average approximately 30% of total pharmacy claims for the 3 periods. And this slide contains the dental and vision claims experience as of May of 25. For the dental claims experience, there was a 1.1% decrease. And for the vision claims experience, there was a 18-cent per retiree per month increase for the most recent period. Thank you.
Thank you very much. Anyone have any questions of Michael?
I have a question
Mr. Roca.
for Cassandra. The $1.5 million goes into effect
July 1st.
July 1st, so it's in effect.
Correct.
Okay, did you guys count, was that the numbers for the $1.5 million or the million?
This is from the million. Yeah. This
How
is
much,
from-
how much roughly will that reduce the number of people? I mean, is it?
The
in-
1.5? Since we reported that the lifetime max had been increased from 1 million to 1.5, we've only saw 2 applications come through for members requesting to enroll in Anthem. We track that so we can tell the before and the after. But those members that requested make a change, they have a 6-month waiting period. So we let them know in December when it was increased so that members could start submitting their forms. And we've only received 2 increases. So I don't expect to see a big difference at this time. However, we are still working with and collaborating with the county to further get that increased or better yet removed.
When are we going after 2 million?
We're
I'm being
working,
facetious.
we're working on it now. So we're getting ready to send a letter out to the
Good,
county
good.
this week, actually.
Thank you.
Thank you very much. Federal legislation, Stephen.
We have some materials that are in the packet for your reference, in no particular order, but just because of the way things are coming out of Washington right now, it's kind of a bit of a jumble. But number one, the Supreme Court has kind of authorized or approved the way of ACA, Affordable Care Act preventive screening services are kind of recommended and incorporated into non-grandfathered plans. So continuation of that. We just had some new guidelines on breast cancer screenings for individuals at average risk. Those would begin at age 40 and continue through age 75. So not a tremendous kind of impact there, but it exists. We included in the packet a chart that we typically produce, which is basically a kind of summary of the different levels or implications related to flexible spending accounts, health reimbursement accounts, and health savings accounts. Wouldn't normally bring that to your attention, but there were some references in the kind of big, beautiful bill that was in the House that had some elements of perhaps extending health savings account eligibility to Medicare eligible working adults. Didn't directly impact LACERA members and probably wouldn't. We just learned last night from our compliance team in Washington that that element was actually stripped from the final bill. So it doesn't really apply, but it was kind of something we've been monitoring on behalf of LACERA, trying to get a sense of how that would work. And so it's kind of off the table, but that's one of the reasons why that chart was in there for your reference, but you could kind of put that aside at this point. And I think the last item, we had an inquiry about the impacts of tariffs and specifically on prescription drugs. So some anecdotal kind of research just to share, but number one, I think the US imports, I think roughly 80 to 90% of all prescribed medications. So we're bringing in that amount. What I found most interesting is that we also import, or actually, I guess China controls probably up to 90% of all the kind of active pharmaceutical ingredients that go into medicines. So even if we were to kind of do production in the US, we'd still have to source those active ingredients in order to make those medications. So we are kind of a little bit under a barrel at this point. But if the tariffs do go into place, whether it's 200% or something less, it's certainly going to have an impact on overall costs for plan sponsors and perhaps for members. And shortages could also be kind of accentuated. So it's, it's in the short term, it's not going to be good. Longer term, does it make sense? We'd want to produce more of the medications we need in the United States? Absolutely. But that is a long-term objective and a long-term solution. So we kind of have to see what comes of it, but don't know if it's 200% or 100% or 50%. We'll have to see what happens over the next 4 to 6 weeks.
What percentage does Ireland produce? They only produce a small percentage in?
I think one of the charts I looked at, because I did look at it last night, was it seems like there's somewhere in the 20s, 20 to 25%.
China produces the rest?
China and India produce the bulk of kind of what is imported into the United States. Ireland does produce some, but it's just kind of the distribution globally is very different.
We don't have any ingredients. We don't have the ingredients.
The active ingredients, from what I could research, are mostly contained in China. So even China would export those to India, who would produce the drugs, and we would still import them from India. So it is really, really interesting dynamic there.
Wayne?
Thank you. Regarding the FSA, HSA, HRA comparison chart, the chart wasn't actually attached, and I'd love to be able to see it just for my own.
Absolutely.
Okay, thank you. So if we could get a copy of that, that would be great.
Nothing else to share?
In this big, beautiful world of ours, and that's all you got, huh? Well, I feel optimistic. The president's going to order the pharmaceuticals to reduce the prices by 80%. So yeah, happy days are about to happen again. Items for staff review, Terry?
I have nothing.
Nothing. Items for future agendas?
Nothing.
We'll just say good of the order for the big meeting and motion to adjourn.
So moved.
We are adjourned.
Okay.